All right. And I think we might get started for Rare Disease Day 2022 and welcome everybody to what is the last, I hope, fully virtual Rare Disease Day event that the GSNV will be hosting. Hopefully we'll be moving to hybrids or at least face-to-face, whichever, but hopefully this is the last fully virtual event that we'll have. So welcome. So I'd like to begin by stating on behalf of the Genetic Support Network of Victoria that we would like to acknowledge the traditional custodians across the lands on which we meet today and pay our respects to elders past, present and emerging. We acknowledge the stories, traditions, living cultures and connection to the land of First Nations peoples. We extend our respect to our Aboriginal and Torres Strait Islander colleagues and guests who are with us today. I would also like to take a moment to acknowledge our global family in Ukraine. We stand with Ukraine and against violence, oppression and inequity at all times, anywhere. And also a moment of thought for our colleagues in Queensland who are experiencing devastating Mother Nature. There are more than 2 million Australians living with genetic undiagnosed and rare disease. That's an amazing number. But we'd be here if it was one person, one family, one disease, one community, to strive for one world of equity and access and hope. The things that we're seeking are not new and they're not surprising. Everyone wants these things for themselves, for their families, and for everyone else. Thank you to everyone who is here today in our virtual room. We have all the stakeholders who can make a difference, all those who can help us achieve our needs and our expectations. We have health professionals, we have researchers, we have industry, we have policymakers, we have patient support group leaders and people with lived experience. And it will take us all to make sure that no one is left behind. This is from the UN resolution about living with rare disease, the first of its kind that was passed by the General Assembly in December last year. It is the right of every human being without distinction of any kind to have access to the enjoyment of the highest attainable standard of physical and mental health and to a standard of living adequate for the health and well-being of oneself and one's family. This is a huge statement. It brings together all aspects of quality of life. It will guide the work of the GSNV, and it affirms the importance of a holistic approach. More than 60 countries sponsored or co-sponsored this resolution at the General Assembly. Australia was not one of them. We have work to do. Usually on Rare Disease Day, I talk about the achievements of the GSNV from the previous year. I'm so proud of the GSNV, our team and our community, particularly over the past 2 years. It's been tough on so many levels, yet here we are, with positivity in our hearts, with courage and determination, and a burning commitment to a better future. So this year, I'm going to look forward. The GSNV has provided our annual update of our work and progress against the Department of Health National Strategic Action Plan for Rare Disease to both the federal and the state ministers for health, and communicated this across our community. We'd be happy to make it available to anyone who hasn't seen it. This year, the GSNV will target a number of priority areas, and your work this afternoon will help to inform these priorities and the projects that I will also share. A united sector. where we will work together to benefit all conditions. Lifting the profile is about having the profile of rare disease recognised as a collective group and as well known as collective groups such as cancer. Equity of access to everything. That's an ongoing challenge for all of us. Building an evidence base. My pleasure to announce today that GARD Collaborative Australia, of which the GSNV is a founding member, will be undertaking a landmark survey into the Australian genetic undiagnosed and rare disease community. This will create benchmarks we can all use in our advocacy, our submissions, our applications, and that we can measure across time. We will need your help to create this truth. So please watch out for the survey. We will be launching it in the next quarter. Equal partners to truly represent by listening and engaging. And we are seeking to move the dial on patient centricity, from meaning that patients are often in the middle while everyone else brings their knowledge and expertise to plan what patients need. We want to build a true partnership of respect where everyone collaborates and works together. Discovery and innovation, we know these are exciting times. We will stay across them and share our knowledge in collaborative partnerships, in understanding new technologies and their applications, and ensuring that patient groups, people with lived experience, travel along with the science. These are a number of our key projects for 2022, and I'm going to touch on them very quickly. Genomics in Schools is a program we launched last year where we had more than 250 schools download our materials for year 10s. And we've been asked to develop that further into science challenges for grades 5 and 6, years 7 and 8, and year 9. So we'll be doing that and working with the Department of Education and the Department of Health to do that. Many of you participated in our living library or building a living library a couple of years ago. It's time to do that again. It's time to capture lived experience. And in doing that, we'll be capturing also the value of knowing and what Diagnosis Day was like. And we will make those available for anyone who wants to use those in a responsible way. So we have a consent process to do that. Patient pathways and critical conversations. What are those critical conversations? What questions need to be asked when? We have a project about those. We have working groups that we've developed. We have a mental health working group. We will commence an aging with genetic undiagnosed or rare disease working group so that that becomes a topic of discussion in our aged care system. Newborn screening, we have a group that is looking at what are the things in newborn screening that we need other people to be aware of, to be thinking about. How do we advocate collectively for newborn screening? I mentioned our landmark survey, and of course, as always, advocacy, representation, engagement, and inclusion. But now on to Rare Disease Day. From across the world, we have a really great program today. This morning draws upon our international colleagues to explore global themes around genetic undiagnosed and rare disease. We are very grateful to our colleagues who have so generously recorded the presentations that you're about to see. These presentations provide opportunities to leverage work that's already happening, to learn the lessons that others have already learned, and to explore where we can stand together and add our strength to projects and activities. This is consistent with our commitment to collaboration, to no duplication, and maximising our resources and expertise. There will be a comfort break along the way throughout the presentations. Our workshop this afternoon will connect our community with key stakeholders to begin discussions and prioritisation around topic areas such as education, research, industry, advocacy, and integrated care. We are incredibly appreciative of the support from our stakeholder colleagues to join with our community to explore these topics. I'm also very grateful to all of you, to our community, for your ongoing engagement, for your engagement with and ongoing support of the GSNV, for keeping our work relevant, our voices representative, our knowledge current, and our resolution strong. Holly will explain the workshops to you at the beginning of that session in more detail. So now it's time to hear from our colleagues from around the world. Thank you.
Hello, I'm Sharon Terry, and I'm the President and CEO of Genetic Alliance. We are the world's largest advocacy organization supporting advocacy organizations. I've been to Australia to help, in fact, in a couple areas with advocacy groups there, and have worked for a while with all of you. Very happy to see you this way and wish it was in person. Genetic Alliance was founded in 1986 as an umbrella organization for genetic diseases. We are very happy to have wonderful founders who saw that we were really about empowering individuals, families, and communities so that they could take charge of their own health, including research and services. We've been working in this arena over all these years, supporting advocacy groups, supporting policy issues, and also moving the research agenda forward by creating many, many tools, all of which are free and available to you. Our priorities in 2022, the year coming up, are many and diverse. First of all, we have some national priorities with regard to legislation around getting whole genome screening covered for all the children in the US who don't have access to this important technology. In fact, we are recently announcing the establishment of I Hope Genetic Health, a program of Genetic Alliance, which will be a global program and will allow us to actually do the sequencing that is necessary to find a diagnosis and better management of children and undiagnosed individuals all around the world, especially from areas where they cannot afford this, where the community is under-resourced. This project was born, in fact, of a discovery made by an Australian family and a researcher, Stephen Damiani and his wife, Sally. Their son, Massimo Damiani, needed a diagnosis, and Ryan Taft, a scientist working in the early 2010, 11, 12, 13 area, was able to diagnose Massimo. Ryan called the program I Hope as part of the company Illumina, and has diagnosed now many, many children, having sequenced about 1,000 of them across the globe. And recently, on November 16th, 2021, Illumina announced that it will give a grant of $120 million to Genetic Alliance to set up a program whereby we will go all across the globe working with families, communities, clinicians, labs, helping to diagnose children and those in need of a diagnosis. This grant is for reagents and software and machines, sequencers, and so we'll be looking for partners, and we'll be looking for additional funds so that we can support all of this throughout the pipeline. In addition to this important program, we have several others, including we run a biobank that any advocacy group can use to bank samples for their members. We also run an extremely large registry system called the Promise for engaging everyone responsibly, where all of the data is owned by the individuals and the platform is owned by the individuals who share their data. This is free to any advocacy group to set up. It's as simple as 1, 2, 3. It takes about a day, and you can have a registry up and running or a study or anything that you need to do better engagement with your families. And if you're a family member, you can join very simply at lunadna.com. What I think we can offer the Australian rare disease community are certainly our lessons learned, and I'm always happy to do that. You can find me easily on the internet, sterry@geneticalliance.org. I'm working to connect advocacy organizations, individuals, clinicians, and researchers. And with our tools being free to all of you, we are very happy to share so that you might skip over some of the mistakes we've made. I come to this because my two children have a genetic disease. They were diagnosed in 1994, before the internet really took off. And although it was those early years, with my master's in religious studies, I was able to discover the gene for my kids' disease, set up biobanks and registries and so forth. And so I have hands-on experience and know what it's like to live in a family that is seeking solutions, that's seeking healing, that's seeking treatments. So I wish you very, very well on this Rare Disease Day, knowing that we are a global community, that we are brothers and sisters with one another, and that we can walk together as we try to alleviate suffering in the world. Thank you.
Hello, my name is Durhan Wong Rieger, and I am President and CEO of the Canadian Organization for Rare Disorders and also Chair of Rare Diseases International. Thank you very much for the opportunity to speak to you about the global rare disease ecosystem, looking at where the rare disease environment is at the moment and what we think it might be like as we progress over the next few years. Obviously, to be honest, none of us really can predict what rare diseases might look like, even in the near future. And especially as we're still recovering from COVID, the pandemic, it makes it even more uncertain. What I've presented here are, I think, I'm calling 3 possible alternative future worlds for rare diseases. What you've got here is our first alternative world, one, which is what I would call Back to the Future 2019. What this really suggests is that we will be moving into the future, picking up on rare diseases, kind of where we left off pre-pandemic, that we will still have the ability to move forward on innovative technology for diagnosis and treatment, which has been one of the big drivers, and recognizing, though, that that also represents one of the biggest challenges, and that is, how do we continue to maintain the focus on research and development, and can we actually sustain access when the world is going to be continually constrained in terms of its ability to support all of the innovations coming in? So that's the first world. Alternative world 2, I'm kind of calling Groundhog Day, where 2020 kind of looked like 2021, and it kind of looks like 2022, kind of looks like whatever is going forward. That is that we can anticipate that COVID, or some relatives of COVID, will continue to dominate the healthcare landscape and maybe our whole societal landscape. So the challenge for rare diseases, of course, is that we're going to be competing for health resources for everything from research to disease management. The big opportunity for us, though, is to kind of continue what we've been doing over these last 2.5, almost 3 years, is looking at the parallel pathways for rare diseases. How can we continue to support and to foster research and the management of diseases? So pretty much we're going to keep repeating what we're doing right now. Alternative world 3 is interesting, what I would call strange love, or how to stop worrying and love COVID. That is, we can anticipate that the pandemic, as we know it now, is going to transition from being a pandemic to what people are calling more of an endemic. It's not going to be so much crisis driven. We're not going to just be reacting to what's happening, but we're going to be able to predict where the course of the disease might be, or similar diseases. And we're going to be able to then prepare and plan for how we're going to live with COVID or other related diseases, very much as just another disease like the flu. The challenge for rare diseases, though, even in this environment, of course, is to ensure that our global rare disease community works together and to be able to deliver for our patients globally. What we do know is that, and what COVID has recognized, of course, is that there are huge disparities across geographic regions, across economies, and that is in fact creating a lot of the disparities that we see certainly in rare diseases. And our challenge is, if we have that opportunity to really advance on the global rare disease community, are we going to be able to address those disparities? So 3 worlds, not really sure, even at this point, right, which one of these will be, but we do need to be able to prepare for how we might respond as we see which ones are going to be unfolding. Regardless of which, I just want to talk a little bit about what we see as some of the drivers, though, in terms of the healthcare ecosystem and how those are actually implicated or impacting rare disease. The first, I think it's most important, is the fact that innovative technologies, we've seen them accelerate in terms of the diagnosis, treatment, and prevention of diseases, and certainly have been key in terms of rare diseases, and also, of course, integral to COVID. What we will continue to see, I think, 2 big streams. One is gene-based diagnosis and treatments, and the other are going to be what I kind of call digitally enhanced care, including what will be personal wearables, the increasing reliance on e-health, on telehealth, the increasing utilization of electronic health records, and importantly, across these data registries. The second big trend is the health financing, and this kind of reflects the fact that we've got these innovative technologies, but how are we going to be assured that we're going to be able to sustain them and to be able to take them to their optimal advantage if in fact they're going to be the perceived huge budget impact, at least as they're brought in. So we're going to see the need for an investment in health that is going to be driven by these technologies, and if used appropriately can certainly increase prevention and well-being, but the challenge is going to be, can we pay for the treatment driven by the patient and healthcare needs? There's sort of a polar dichotomy in terms of where people want to be. Are we investing in health and prevention? Are we going to be caught in the trap of paying for treatment and really just looking at how do we reduce the short-term needs? The second aspect of this health financing is we're going to see healthcare continue to compete with other resource needs. So certainly within, as we're doing now in terms of comparative effectiveness among diseases, looking at cost, comparative utility, cost utility, but we're also going to be looking at other kinds of societal priorities, including non-health investment opportunities. So we still will be continuing to invest in health, but we have to really think about how we're going to be able to sustain that when there are other competitions in terms of resources. Second set of drivers we're looking at is including the global and national policy supporting local opportunities. This is something that we've been on this path, especially among the global communities. But what we do know is that 2019 universal health coverage, we've got an inclusive and designations for rare diseases. It's really important for us to be able to point to the need for rare diseases to be specified in universal health coverage policies and programs. Just this past year, we had the UN Declaration that was adopted by the UN General Assembly, which broadens the scope of rare diseases to look at social, economic, educational, occupational, gender disparities, making sure that those are recognized as important priorities within the social development goals in terms of member states, but also in the work that we're doing to actually look at the best possible quality of life health outcomes for patients with rare diseases. We introduced, I think, and really we'll see increasing support for the WHO Rare Diseases International Collaborative Global Network, where we hopefully will be able to look at centers of expertise across the globe that are actually increasing the access to specialists and hopefully be globally networked to each other. And then the global access to medicines. This is a strategy that we have seen the WHO put forth in terms of essential medicines. We are looking at it in terms of essential rare disease medicines. And we did, in fact, have a publication that came out earlier, just the latter part of last year, really identifying what we see are the 200 or so essential rare disease medicines. Another big driver that we want to recognize are the patient-led multi-stakeholder collaborations. This has been an essence of where we have been driving a lot of the global policies, but we're also going to see, in addition to Rare Diseases International, the increasing relevance of our regional rare disease alliances. ALIVER, which represents the Ibo-American Alliance, both in Europe and spanning across to the Latin America. APARDO, the Asia Pacific Alliance of Rare Disease Organizations, increasingly bringing patient organizations, but other stakeholders together to work in collaboration, coordination. And newly emerging is the Africa Rare Disease Network. So more work around regional alliances that are also drawn upon the global alliances. The coordination, I think, is going to be something that's going to be hugely important, and we're seeing a lot of that taking place in order to really address the needs for having much more streamlined processes, but also more equitable processes. So we're seeing coordination, collaborations around the regional reviews, the assessment programs, providers, research, and in terms of data management, data registries. I won't go through all of them, but I think many of us are involved in and have taken part in some of these collaborative initiatives. And I think we'll see more of them from the regulatory side, the research side, the assessment side, and certainly look at something like the Belgium, Netherlands, Luxembourg, Austria, a joint procurement program as a potential model for countries working across borders in order to have more cost-effective and more timely access to these rare disease drugs. The next driver, just wanted to identify, is something that's hugely important in order to have optimal rare disease care, and that is improving diagnosis. This is obviously going to be facilitated a great deal by the collaborative networks and also by the technologies that are being brought in. And importantly, we see the use of artificial intelligence to update the kinds of protocols and algorithms that can be made available to healthcare providers in order to more rapidly diagnose diseases, whether on the basis of symptoms, that is phenotypes, or on the basis of their genotype. So this is something that we see is going to be not only the future in terms of the technology, but also hugely impactful in terms of being able to get patients that are able to have access to care and treatment. So everything driving back to being able to do accurate diagnoses. Also would like to obviously talk about the fact that there's therapeutic development. And I want to put in here that a lot of this is actually driven by patient consortiums, and we're seeing more patient consortiums being formed, patient consortiums that are also bringing in multi-stakeholder partners in order to advance the diagnosis, advance the understanding of the diseases, advance the identification in terms of key treatments for the diseases, advancing the clinical trials for the diseases, and making them much more available in terms of the awareness, education with the healthcare providers and the centers, and obviously really continue to do the advocacy for reimbursement. So these are some of the important patient initiatives, patient-led initiatives that have been in place from, muscular dystrophy, cystic fibrosis, cystinosis, AKU, and then two, I think, consortiums that I think are really important. The first at the top is the Bespoke Gene Therapy Consortium, which the FDA and NIH is putting together to really try to drive out the research and hopefully development of gene therapies for very, very small, ultra rare patient populations. And then at the bottom of that list, the CZI Rares One Network, which is a funded initiative to identify and to support patient-led collaborative research, not only in terms of providing the funding, but also the support in terms of working together. So we're going to see, I think, a great deal more in terms of patient organizations being able to take a leading role in terms of helping to drive forth therapeutic developments in their specific disease. I think the other thing to recognize is as we look into the future, interestingly enough, I say rare diseases are going to become increasingly common, but also increasingly rare. We know there are about 6,000, 7,000 rare diseases. About 250 are added annually, that is named diseases. We can now identify the genetic cause of about 4,000 of these rare diseases. And within that, then we have more than 600 orphan drug approvals between the FDA and the EMA, but also other jurisdictions. And unfortunately, still treating only about less than 6% of the rare diseases, but totally benefiting maybe some 13 million patients. So huge in terms of the increase in terms of drugs that are available, but recognizing they still only represent a small fraction of the diseases and also a small fraction of the patients. And what we can see is that, many of these diseases, of course, are pediatric in order. Surprising to me, quite frankly, was the fact that more than 80% of these are what we call ultra rare diseases, estimated by the Orphanet as having an incidence of less than 1 in a million. This actually has huge implications of what we can do in terms of diagnosis and also in terms of treatment. They represent, about 80% of the population burden, though, in rare diseases, that is the number of patients with rare diseases, is actually covered by only about 4.2% of the most common rare diseases. So huge disparities in terms of the very large rare diseases and the very, very small populations. And still worldwide estimate somewhere around 263,466 million. What we also recognize is that we're having increasingly, and that's why I'm saying there's increasingly rare, is that gene mutations are defined. And they're being defined in subsets of what are common diseases. Many of these are cancers. And some of these are actually having orphan drugs and have for since the beginning, orphan drugs that are based on these genetically defined subsets, these genetic mutations as orphan drugs and are being marketed as orphan drugs. And the question is whether or not and how these are going to be increasing as we do more and more of a genomic diagnosis to find, increasingly small subsets of our much more common diseases today, cancers, but also many other genetically diseases that actually could have genetic mutations that are part of a larger disease population. What we also recognize, though, is that increases what we are already experiencing, and that is there are disparities and inequities across rare diseases. And this presents for us both challenges and opportunities. What we do know, as we said, is that we're getting more and more sophisticated technology, platforms, AI-empowered diagnoses. And this is going to really help in terms of being able to improve and increase the timeliness of diagnosis. But in fact, it's also going to be a huge strain in those economies that do not have access to this advanced technology, to healthcare professionals who do not have that same access. And certainly when we talk about it in terms of specialty care, is how do we move from the ability to diagnose into the specialist care. So the real challenge is going to be to create more specialist sites, more access to specialists. Some of that will be through virtual collaboration. Already talked about the Collaborative Global Network, which is in fact going to be very much based on virtual platforms, and that may in fact help to bring in people that are distantly located, including specialists and patients, with greater reliance on telehealth and digital empowered e-health networks. The EU reference networks already exist across Europe, and do they serve as a model for networks that might be elsewhere, as will the WHO RDI collaborative global networks, which are in the process of being developed at this point. The other part in terms of the inequities, though, is really around all the other aspects of rare diseases that, identified certainly in the UN Declaration, but are really impacting in terms of quality of life for patients right across the globe. Social inequities, economic disparities, educational disparities, occupational, disparities. Two of the global the initiatives that we are looking at is the universal health coverage, where we've been able to identify rare diseases as a distinct population, hopefully providing opportunities for us to be able to call upon emerging healthcare systems to really include and to be able to adequately address rare diseases as health services and health provisions are coming in. And then the UN Declaration on Rare Diseases. This is something that has been identified as being integral to sustainable development goals, and our opportunity again is to be able to address a broader scope of the kinds of challenges that patients who are living with rare diseases experience, in addition to the physical, the health challenges. So this is, again, the opportunities, but in order for us to take advantage of those opportunities, the need to work globally, the need to specifically acknowledge the kinds of disparities and inequities that exist. Rare Disease International, I'll just cover quickly, is in fact our global alliance of rare diseases organizations. Our mission is in fact to provide that strong common voice, and our vision is that we do have the support in health. Our objectives have been to promote rare diseases, to represent the rare diseases on the international space, but as importantly, to enhance the capacities of members. And this is something that we're hopefully going to be able to involve all of the patient groups that we're engaged with, national alliances, specific disease organizations. Part and parcel to that, in terms of, as we talked about, in terms of the inequities and disparities, is that rare diseases themselves have always been a marginalized population. And so our goals have really been to include rare diseases and healthcare systems, but also then is our opportunity to make sure that populations within the rare diseases are also benefiting from the developments, certainly in terms of the Sustainable Development Goals. Children, families, women. We looked at young adults, and they're entering the workforce, entering into higher education, and also the huge need in terms of being able to ensure that there is the medical expertise, public awareness. Not a trivial point to acknowledge, though, that what COVID has been able to do is to help recognize where are there inequities and how does that really lead to increasing social exclusion. These are some of the initiatives that we have kind of pioneered and worked in collaboration with other global organizations, including the WHO, including the International Research Consortium, the United Nations Declaration, to move forward in terms of creating a global environment for which we can actually work in terms of advancing rare diseases at a national level and a regional level. These are some of the initiatives that we're working with across RDI, obviously the WHO, looking at the International Research Consortium for Rare Diseases, which again, we have about 17 patient organizations that are members of, and working alongside of the industry and the funding community to look at joint projects that would actually address diagnosis and innovative therapies. These are the regional partners that we have, and we see Rare Disease International as being able to work not only with collaboration with our regional partners, but hopefully working through our regional partners so that we're able to actually have much more that is going on the ground with the national alliances, with individual disease groups, to work together towards that common goal of a world in which everyone who lives with a rare disease can have the opportunities for optimal access to care, to treatment, optimal quality of life. Thank you very much.
Hi, I'm Lauren, and I am the Director of Engagement and Support at Genetic Alliance UK. And I'm also currently, with my colleague Nick Mead, one of the joint interim chief executives. So I'm really pleased to be able to be here with you today and tell you a little bit about the UK perspective on rare conditions, how we'll be celebrating Rare Disease Day, and looking at the different landscape in the way that it affects people living in the UK that are affected by genetic rare and undiagnosed conditions. So for those of you that might not know, Genetic Alliance UK is the UK's largest alliance of organisations supporting people affected by genetic rare and undiagnosed conditions. So our members vary in size, everything from big organisations like the British Heart Foundation down to really small organisations where there might only be a handful of affected people and they're often volunteer led. But our members and the community they support are at the heart of all of the work that we do. We also have two long-standing projects. One is Rare Disease UK, and this is a campaign focused on making sure that the UK's rare disease framework is as successful as possible. And I'll be talking a little bit more about that later on. And through Rare Disease UK, we're also the official organiser and facilitator of Rare Disease Day in the UK. We also run the Swan UK project, which has been going for just over 10 years now, and that's the only dedicated support in the UK for families affected by a syndrome without a name. So that's a condition so rare that it's often impossible to diagnose. And it's through Swan UK that we have contact with the lovely Heather from Swan Australia. So through Swan UK, we also organised the UK's Undiagnosed Children's Day. And for us, this is always the last Friday in April. I know for you guys, it's slightly later, I think, because of clashes with Anzac Day. But this year in particular, we're really looking to try and create those links and see how we can support your celebrations whilst you can engage with ours. So as you can imagine, we have quite a large portfolio of work through these through our 2 different projects and also through Genetic Alliance UK itself. And there's a limited time today. I'm going to just focus on a few key aspects to give you a flavour of the work that we're doing and some of the things that are most important in terms of our agenda at the moment. So I'm going to talk to you a bit about COVID-19 and the impact it's had on our community, because that's inescapable at the moment. I'm also then going to give you a bit of a highlight and whistle-stop tour through rare disease policy in the UK and kind of where we're at with that right now. And then it wouldn't be as it's Rare Disease Day, it would be wildly inappropriate if I didn't talk to you about our Rare Disease Day plans. So I'll give you a bit of an overview of what we're looking to do today and how we're going to use Rare Disease Day to really kind of shine a light on some of the voices that we don't think are heard often enough. So starting with COVID-19, this was a really difficult time for the whole rare community, and I'm sure that you have very similar stories from your community as we do in the UK. So most of our community was shielding. It was very, very difficult to get hold of good quality information. People weren't really sure what to do, and there was a real sense, and there is still a real sense, of being very forgotten and being very invisible. And so very early on, we decided that we wanted to try and do as much as we could to obviously support our community through these difficult times. So some of that was looking at things like campaigning around making sure that people with rare conditions were included on the vaccine list, making sure that they were properly accounted for and classed as extremely clinically vulnerable where appropriate. But also we wanted to do a bit beyond this. So in July 2020, using data from the EURORDIS Rare Barometer survey and also our own meetings that we'd been having with member groups during this time, we decided to put together a report. And in this report that we found that people were really, really struggling. So 66% of respondents said that their usual treatment and healthcare had been interrupted and that they felt this had been detrimental to their well-being. 80% of our community found that their hospital care was affected. So with 40% of them reporting closure of units and 16% saying that they couldn't get the necessary equipment because it had been diverted for COVID care. We also found that access to medicines are being disrupted. So 1 in 5 people who responded had had some kind of disruption to their usual ability to access their medicines. And also that support had been slashed. So especially in the early stages when PPE equipment was really difficult to get hold of, many people just all of their support stopped. So they were left at home with no information, having to provide all their care and treatment for themselves. We also knew that there was a real impact on the people who were trying to support those communities. So as I mentioned, Genetic Alliance UK is an alliance of 200 organisations, and many of those groups are very, very small. And a lot of them are run either by sort of, 1 or 2 members of staff or skeleton staff, or they're run by volunteers. And very early in the pandemic, we set up a virtual meeting every Tuesday just so that we could check in with all of our member leaders and see what was happening. And we realised really quickly that a lot of them were sort of exhibiting signs of burnout. And because they were trying so hard to support their communities, but also they were supporting their communities, from their home, many of them were working in their bedrooms or their lounge, that they were really struggling with the kind of boundaries of how to protect themselves while also trying to do everything they could for the people they were supporting who were desperate. So we ran a CEO survey, quite small scale, but just to get a sense of what was happening. And we just asked about what's your experience right now of leading your community. And we found that 63% of people who responded told us that they were concerned about the impact of COVID-19, not only on their own mental health, but also as well as on that with their staff and volunteers. And so we decided that we needed to act quite quickly to do something about this. So we managed to get hold of some emergency funding, and this enabled us to continue our Tuesday meetings so that people could continue to come along. They could access peer support. They could talk to us about things that were happening, and when needed, we could intervene and help campaign. So an example of this, when there was a real issue around people being able to get children children back into school and the stress that was causing. But we also felt that more was needed. So we managed to get hold of funding and we set up a new project called Building Rare Resilience. And this was working with a specialist psychotherapy company called Rare Minds, and we provided 12-week programs for groups of 8 to 10 charity leaders or support group leaders to come together and to learn emotional resilience, to talk about what they were experiencing and to find ways to, be able to manage those boundaries and really to have a kind of safe output for everything they were going through. So we've now run 4 of these 12-week sessions, and all of the groups continued to meet independently afterwards. They developed really strong sort of bonding networks. They found that it was really providing them with the kind of peer support as a leader that they hadn't had before. So in the last 3 months, we've also managed to gain extra funding so that we can continue to facilitate that, so that once a month, these groups will be able to meet again with a qualified psychotherapist facilitator, and they can have group supervision to help support them around all of the kind of issues to do with running support groups. And this is now something that's fed into our work and is a real long-term priority for us, that we don't think it's just enough to capacity build and to provide information, but actually we need to make sure that everyone is looking after themselves and that they're not risking burnout in going above and beyond in what they're doing when they're constantly trying to support their community. Because we all know that a lot of people that work in this sector are coming because of personal drive, and that's what makes it so powerful, but also makes them quite vulnerable. So we want to make sure that we're really supporting their emotional well-being as well as all of their kind of practical and policy needs. So moving on to policy, the kind of key piece of policy for us that we've been working on for a long time now is what started out as the UK Strategy for Rare Diseases. So this was originally published in November 2013 after a campaign that we ran with a number of stakeholders. So we brought together organisations, individuals and corporate, so particularly pharma, and we came together and we campaigned very, very successfully, and eventually the strategy was released. This was the first time that the 4 UK governments had come together to produce a single comprehensive strategy for rare diseases. And there were 5 themes, which were empowerment, diagnosis, prevention, early intervention, and better coordination of care, and also research and development. And within these themes, there were 51 commitments which were put in place, and that these were going to be used by all of the 4 devolved nations in the UK. So it's England, Ireland, England, Northern Ireland, Scotland and Wales, and that they would be used to kind of roll out the strategy. So the strategy then fed into these implementation plans, and you can see the dates there of when they were published. And there were some successes from this in the early stages. So we now have a National Institute of Health Research bioresource, and also we have a National Congenital Anomaly and Rare Disease Registration Service. However, there were difficulties around the strategy in terms of measuring its impact. This is something that we attempted to do through our regular survey of people with rare conditions. So this is every 5 years, we do a large survey of people and we look at how are things progressing for them, what's changed and what hasn't. So in 2020, we released our 3rd report, and we found that generally, although there were some improvements across the board, maybe not as much as we'd like to have seen, that people with rare conditions were still insufficiently served by the system. Diagnosis remained as crucial as ever. That awareness among professionals is valuable and definitely needs improving, and there's some great work by a UK charity called Medics for Rare that are doing some brilliant work here, there, and I'd encourage you to go and check out their Rare 101 modules that they're looking to use with healthcare professionals. Professional care coordination is rare, but really necessary. There was not a lot of change, and that often it's still the person with the rare condition or their family themselves end up doing the care coordination. And that pockets of excellence do demonstrate that the system really can deliver, and that that good practice should be shared and rolled out to other areas. So following on from this and post the UK Rare Disease Strategy, we now have the UK Rare Diseases Framework. So this was published in January 2021, and you can see here that there's been an update. So there's now 4 priority areas, and there's 5 underpinning themes that feed into this. and that there's 8 principles, which I haven't listed here because they were too big for one slide and it would have made it way too wordy. But these core principles are there to really help that kind of cross-border collaboration between the devolved nations. So at the moment, each of the devolved nations are working on their action plans, and we're hoping and expecting that potentially England should be the first to publish its action plan, and we're hoping that that might happen on Rare Disease Day or around there. So this current cycle of rare disease policy and the publication of the framework started in 2019 when Baroness Blackwood launched the National Conversation on Rare Diseases, and this is where the priorities came from. And this was a big piece of policy consultation. There was a really high response rate, over 6,000 people responded. However, when you looked at the responses, the diversity was very, very narrow. So the most of the people who responded were white females over 45. And there's been some really powerful campaigns run in the UK, particularly by 2 UK-based organisations. So Medics for Rare that I mentioned earlier, but also RareQual. And they ran a Whose Voices It Anyway campaign, which was really looking at the lack of diversity within the consultation that led into the framework. And I think this campaign combined with experiences through the pandemic, where, you know, in the UK, the pandemic has really served to highlight some of the kind of health inequalities that exist and the importance and the sort of significance of intersectional issues. And the impact that can have on people and their families. And so for Rare Disease Day this year, we wanted to make sure that we were really listening to what people were saying, and we were taking account of this context and this need for diversity and the need for all policy and for all work in rare diseases to really be representative of the population that are affected by rare conditions. So for Rare Disease Day this year in the UK, we are particularly thinking about this diversity angle. So we want to provide a platform and space for these voices that aren't heard very often. And at the same time, as usual, we want to kind of celebrate and demonstrate the solidarity both within the UK, but also at a European and an international level. And so thank you again for the chance to come along today and talk about our plans, because we all know that individually things might be rare, but collectively they're common. And it's not enough for us to be sort of narrowly focused on our own home turf. We need all of these international links to really bring people together. So we'll have 4 videos on the day that will drop in the week just before, and each of those have been chosen to highlight a particular story that's generally not often heard. So with a particular focus on people that come from minority ethnic background or from the LGBTQI+ community. And if you keep an eye on our social media, you'll be able to see all of those. I can't give away too much more because we want them to be a surprise. We'll also be running our Rare Disease Day receptions as usual. Unfortunately, we've had to recently just make the decision to take them back online after we were hoping to have them face-to-face, but that's just not possible. And at these receptions, we will be launching our new report, which is about good diagnosis. So a lot of the focus on rare disease policy in the UK recently has been on a timely and accurate diagnosis, and this is absolutely vital. But what's been really interesting in our conversations with people affected by rare conditions is that actually what they're telling us is that's not the end of the story, and actually that there are much more subtle factors at play as well, and that a good diagnosis isn't just about being timely and accurate, but it also, there's a lot of other factors that feed into that. And particularly thinking about maybe how that diagnosis is delivered and the kind of follow-up support afterwards. So that will be available on our website, and it will launch at the receptions. We're also developing the Rare repository, which we're super excited about, and that will be up and live now. So if you go to our website, you'll be able to find that. And it looks like a house, and basically linking in with the idea of the global chain of lights and people being able to light up a window in the Rare Disease Day colours. We've mirrored that virtually. So if you go and submit your story, then a window lit up in the Rare Disease Day colours will appear on the Rare repository. And then if someone comes along, they can click on that window and read your story behind it. So I'd really encourage you all to go and have a look at that. I've talked about the videos. We're also launching today, having a digital news programme in partnership with ITM Productions. So this will be a feature looking at lots of different aspects about having a rare condition and the UK landscape. So if you're interested in knowing more than I've been able to touch on today, then I'd really encourage you to go and have a look at that as well. There'll be a lot of discussion around things to do with genomics, newborn screening, and we'll also be talking about our Good Diagnosis report, as well as sections from other kind of key stakeholders within the UK's rare community. And we will also be having, in addition to all of the other kind of activity on social media, this year we've been encouraging people to take over our channels. So hopefully, again, thinking of the kind of diversity and the multiplicity of voices out there, hopefully you'll be able to hear them directly through our channels. So that was a bit of a whistle-stop tour. I hope that it's given you a kind of a taste and a flavour of some of the work that we're doing. And if there's anything else you'd like to know, I'm really, really happy for anyone to get in touch. It would be great to have a conversation. You can also check out our website, which I should have put on here. That's a massive error. But if you want to look at any of the Rare Disease Day stuff, you can go to www.raredisease.org.uk/RDD2022. And that's my email address there. So if you are, if you want to know anything more about anything I've mentioned, or you're struggling to find the links, then please do drop me an email and I'll be really happy to hear from you. Thanks again. Happy Rare Disease Day. I hope you guys have a wonderful time, and I'm really looking forward to seeing the photos and listening to some of the other talks today.
Hello, my name is Matt Bolts-Johnson. I work for Rare Disease International, and I'm joining you today to celebrate Rare Disease Day. I've been kindly asked by a genetic support network in Victoria to share some of the experiences that we have at RDI, working with national patient organisations in Australia and globally, and sharing some of the progress we're making in advocating and improving the situation for people living with a rare disease. I'm going to talk today about the work we're doing in developing a global network for rare diseases. Today, on Rare Disease Day, it's an important day for our community to come together, to show solidarity, and to act with one voice to make a difference for the people we care about, to share in our successes, and to give hope that tomorrow will be a better day than today and yesterday. Rare Disease International is a patient organisation, a non-governmental organisation, which has members around the world in over 100 countries. We have national alliances, we have regional organisations like APARDO in Southeast Asia, EURORDIS and Alibera as members, and we also have many international federations. RDI works with the community, and together our community has strength in its unity and in its diversity. Rare Disease International and our community together work globally to shape the global policy environment for rare diseases and to secure greater political support in agencies like the UN and the World Health Organization. But also through RDI, we work with our members to try and build local capabilities and capacities around the world to bring up the community and develop new communities where there isn't one. And that's to drive national action, drawing on that global political support. Since Rare Disease International has been established, we've progressively seen a development of global policy in rare diseases and political support. You can see here that since 2016, that rare diseases is gaining momentum as a key UN policy area. The part of that was culminated when the the UN agreed a UN resolution for universal health coverage in 2019 and included in there rare diseases as a vulnerable group that member states in delivering UHC, universal health coverage, should target the rare disease community and improve access to essential care. The journey so far, Rare Disease International has been around since 2015, but we formally became an organisation in 2018. and we were successful in setting up a UN committee for rare diseases, which enabled us to secure and include rare diseases in the political declaration for universal health coverage. Because of that, the WHO's role and responsibility is to support UN member states implement and take action on those resolutions. So the WHO has signed a memorandum of understanding with RDI, Rare Disease Community, for our community to work closely with the WHO to take action to see implementation of UHC for the people in our community. I'm delighted that actually I'm recording this in November, so a bit earlier than Rare Disease Day, but just last week we had Rare Disease International and the community have pushed globally for recognising rare diseases as the challenges of rare diseases are unique and actually go beyond health and cover more the holistic needs of people with the rare disease. So we were successful in getting the UN to sign up to and adopt a resolution to tackle the challenges of people living with the rare disease and their family. So this new resolution is for people with the rare diseases, and it's really our hot ticket item. It's the thing which we should be now going back to our governments in Australia, in New Zealand, in the US, and using this new resolution to take action locally and improve things. Many of you know rare diseases are very heterogeneous in terms of size and scope, in terms of prevalence, in terms of the different symptoms which and challenges which each rare disease has. But actually, when we look at the rare diseases overall, we can see commonality. We can see that that the size of population can vary around the world. Size of population, national populations, the US, China, very different sizes of population. And that has an impact on the number of people who are affected with the rare disease, depending on their prevalence. So the geographical distances can be a real challenge for people accessing the care they need. And there's a huge social, economic, and geographical landscape which we see globally. Each health system is different as well, and the level of resources available to treat people with a rare disease can vary significantly. It can be from state to state, it can be from province to province, it can be from country to country. But there is quite a rich variety of approaches which are adopted around the world. Another unique needs of rare diseases is in some countries there's a high level of political support and awareness in tackling rare diseases, in others there isn't. But even where there is a political support and a strategy in place to tackle rare diseases, sometimes there's a lack of dedicated funding of budgets available. Many people around the world with a rare disease live with social and cultural stigma. They suffer significant health inequalities in accessing care because rare diseases might be actually excluded from national health insurance systems, or there's a lack of coverage of rare diseases might be included, but the level of coverage can be variable between countries and what you can access. So small populations can lead to a lack of knowledge, a lack of expertise, a lack of investment, a lack of research, and a lack of hope. Health systems are best managed and organised locally as possible, and that can cause fragmentation even in a country like Australia, where different health systems are implemented at a state level. All these things are quite common to people around the world, but the priorities of what is more important can vary significantly between countries and in a country between conditions. What we've seen, size matters. The size of population affects the number of people depending on the prevalence. The number of people affected in a country directly relates to the size of clinical expertise that country will have and the opportunities to develop expertise locally. So for some ultra rare diseases, it's inconceivable that every country will have the same level of expertise, and therefore we need to think about how we work cross states, cross countries, cross regions, to bring people together to build the total body of knowledge for those conditions. We've seen since COVID that virtual healthcare has become a real moved into the mainstream of healthcare in the model for delivering healthcare, and even in countries with where the infrastructure isn't as good, actually virtual healthcare has been proven to be effective and a viable way for expertise to travel to local countries to the patients individually. What we know as well is when we have experts coming together and collaborating, that improves the health outcomes of the people they see. That when experts learn together and learn with patient groups as well, actually that also improves the success of networks in terms of what they aim to deliver. So we've seen around the world this organic growth of clinical networks as a vehicle to tackling rare diseases, where you'll have across maybe Australia or across the EU, the experts coming together, sharing their knowledge, optimizing the evidence base and knowledge that they can draw on to inform care locally. So at RDI, we see that whilst this organic development of clinical networks is happening, we believe that actually we need to support all regions and all countries to start moving in this new model of care and to connect them globally. So just to give you a vision of what a global network for rare diseases would look like, we first of all need to connect centres nationally under a national hub, where you could have 3 or 4 centres coming from Perth through to New South Wales and Victoria, coming together and working nationally as a national network. And then we can connect national networks, like maybe one in Australia, with neighbouring countries in the South Pacific region, and also with Southeast Asia and with other countries in Western Pacific, to form a regional collaboration which can enable expertise to flow and come locally. But then if we start to develop these national, connecting them into regional networks, those regional networks, whether it's in Southeast Asia, Western Pacific, or in North America or Latin America, we can connect them globally to form one global network. And this is maybe as preliminary thinking about what a regional collaboration could look like in Western Pacific. You can see here the Pacific Islands, Australia, New Zealand. There's probably an existing collaboration there already to build on as a blueprint to develop the global network. You can see here the Indian subcontinent, China, mainland China, and some of the islands, and also Malaysia, Indonesia, and other countries in the Pacific the Pacific region who could collaborate together, not solely in new isolated silos, but to first of all foster collaboration locally, nationally, and within the region, and then cross regions. This is a visualization of what a global network could look like, where we build on regional collaborations. You can see here a North American collaboration, a European one, collaborations in Africa, in the East Mediterranean. Ultimately, these are to try and support these regional collaborations would be built on shared experience, shared culture, and shared developing a shared goal, because local challenges can be, the challenges which face our community can vary between regions and between countries. So we need to build from grassroots for this to be a global network, to be anchored really in local populations. So the vision of our global network is really that no matter where someone lives around the world, that they can reach a network of expert centres to access appropriate diagnosis, care and treatment. You can see here national hubs could be single centres or multi-centres connecting together in a hub and spoke covering the whole country like Australia. And these national hubs would act as a knowledge adapter for that, to enable that national health system to plug into a regional and global knowledge base. Those national hubs will come together in regional collaborations with patient organisations as well, based on shared experience, shared culture, and building a shared vision. We will need to put in place a common platform which can enable collaboration to happen between countries and scale up diagnostic capacities. And then globally, we want to create more of a learning system where that all members of the network can join, can share, and can benefit from being a part of that learning system, building global knowledge. Very much on a global level, when we think about all those regions coming together, we see that this global network should be able to inform global policy, and then through the regional hubs and national hubs, implement that national policy and guidelines and leverage technologies. Our ambition, and this always scares me, is about trying to tackle with this network a coverage of 2 billion people through major cities and countries around the world. When we look at how many people that would be with a rare disease, it would be an additional 85 million who could access the care they need through this approach. Over the last 2 years, since I've been working with Rare Disease International, we've been working with our communities, great leadership coming from the Western Pacific region and also Southeast Asia. From Australia, very much, I see great clinical leadership and patient leadership coming from Australia and also from New Zealand. And through engaging with people around the world, we can see that we're starting to build this network already. A network is simply a connection of people, creating relationships and fostering cooperative action. So through engaging with international federations and patient organisations like Genetic Support Network in Victoria, we've connected with about 83% of the global population through those representatives in over 101 countries. Together, that connection, the connection which we have here today, already starts to be that foundation of a global network to be built on. The next step we started to do was to say to colleagues in the patient community, who are your clinicians who you work with, the bright and brilliant you work with on a daily basis. Let's bring them in and start collaborating with them globally. So we've built a panel of experts, and we've done a lot of co-design work on the model of the network, and getting ready for a pilot network which will happen in the coming year. And we've connected with about 222 experts, patient experts, clinical experts, researchers coming together. And now the next step will be to start securing greater political support. By co-creating the global network together, we want to ensure that this isn't a European network approach extended around the world. This is very much designing a global network for what would work for you in Australia and for Western Pacific populations. We've co-designed the model for the network from a 360-degree perspective to ensure that when we set up the network and we pilot the network, it can benefit your local population. So up to now, we've had really great representation from Western Pacific region. We've had about 52 experts come forward. Many of you probably are on this call or workshop today from around 8 countries. Now, whilst we cover 8 countries in this region, that's not a lot. when we look at population size, we actually probably those 8 countries cover about 98% of the population in this region. But there's lots of islands, countries, island states where we haven't connected with. So maybe you know people in neighbouring countries who you could put forward and suggest who could take part. But you also can take part. You can come and join our panel of experts to share your insights, working with Genetic Support Network in Victoria as well, to understand what the challenges are you face in accessing the care you need, and ensure that when we develop this network and pilot it, it meets your needs. Maybe you can, you know of some of your experts in some of the hospitals or expert centres in Australia, and you'd like to put them forward. But it'd be great to collaborate more as we go into next year. Whilst this year we've had the great news in celebrating the UN resolution for tackling the challenges of people with a rare disease, next year I hope we'll be celebrating 2022 as a year that a global network has been launched and piloted, working with the WHO and the patient community around the world. So for now, I want to wish you a great workshop to celebrate. You have great celebrations for Rare Disease Day, and I look forward to collaborating with you next year.
Hello, everyone, and happy Rare Disease Day. It's great to join you because I really relate to your theme of acting globally and acting locally. And today I'm going to give you a local and global perspective around our work at the Murdoch Children's Research Institute. So MCRI is based on the Melbourne Children's Campus, where we have this amazing partnership with the Royal Children's Hospital and the University of Melbourne. And what that means is our researchers and our clinicians are working hand in hand with a major focus on how we can best care for our kids. Rare disease and genetic disorders has been a major focus of the Institute since its inception over 35 years ago, and that continues to this day, as I'm going to show you. The partnership with the hospital and the university is really quite unique internationally, and collaboration is at the core of everything that we do. The MCRI is Australia's leading children's research institute, and we're currently ranked in the top 3 globally. We work in partnership with the #1 university in Australia and the premier children's hospital in Australia, and it's a formidable combination. At MCRI, we're really focused on precision child health, and we are aiming to achieve a future world in which we can prevent disease before it develops, we can remove the trial and error for treatment, and we can ensure that all the information that's needed to care for our kids can be accessed by those that need it. What you're seeing here is a snapshot of our overall strategy on a page, with our purpose being to focus on children having the opportunity to live a healthy and fulfilled life, whatever disorders they are facing. As you can see here on the left, genomics and genetics is really one of our big focuses, along with, and we closely partner with stem cell medicine in terms of modelling diseases and also trialling therapies. On the right, you'll see a range of what are our flagship areas of research, and top and first and foremost is our focus on rare disease. Underpinning all of the work we do and across this magnificent campus, we have all of these areas on the left, which are enablers and platforms that support our work in rare disease, particularly that moving from diagnosis in the Victorian Clinical Genetics Service and then working through into developing useful therapies and effective therapies for kids with rare disease through our Melbourne Children's Trials Centre. We've also formed over the last couple of years a very strong partnership with the 4 top medical research institutions for children around the world. And this is called IPCHIP, the International Precision Child Health Partnership, where we at the Melbourne Children's Campus are partnering with Boston Children's Hospital, with Great Ormond Street Institute for Child Health and Toronto Hospital for Sick Kids. Our first focus in this area is in rare disease and how we can improve genomic diagnosis and drive, by working together, drive for more quicker and effective therapies. As I've mentioned, our genomics work partners very closely with what we're doing in stem cell medicine. And this has really enabled us to model in human tissue a range of inherited disorders. So we can take blood or skin cells from a patient, we can make them into pluripotent stem cells, which are sort of equivalent to those very original cells that form a baby that can differentiate into any tissue in the body. And we're finding this to be a very powerful model to be able to demonstrate disease mechanisms within human tissue and then use high-through screening for drug discovery to look for effective treatments. Now I'd like to talk a little bit about Australian genomics. And Australian genomics is a big national collaborative effort that is led from MCRI, which is bringing together many institutions around the country, and it has a major focus on rare genomic disorders. Australian Genomics was first formed in around 2014, bringing together all of the institutions with an interest in rare disease. And it was funded for the first 5 years through the NHMRC. And this was what the grant call was all about, how we can demonstrate patient benefit through the applications of genomic data, demonstrating cost effectiveness and clinical utility within the healthcare system. Also, how we can develop practical strategies that these can be integrated into the health system, and at the same time working together to increase Australia's research translation capacity in this area. And this network has been incredibly successful. You can see that we've got many, many partners around the country, over 100 institutions and over 450 investigators. And as you can see on the right here, this is demonstrating the increased connectivity and collaborations that evolved in just the first 2 years of this collaboration. And the goal of this is that for rare disease, which may only affect a few people around the country, we can work in Australia as a single cohort of 25 million people, which gives us a lot of power on the global stage. Now, as part of Australian Genomics, we've piloted the application of genomics and for diagnostics across a number of different areas shown on the left. And in the orange box, you see all of our rare disease flagships, where we've brought together a consortium, groups of clinicians and researchers around the country interested in a wide variety of disorders such as neuromuscular disease, mitochondrial disorders, intellectual disability, immunology disorders, cardiovascular disease. And this has really helped us increase the diagnostic rates. We've recruited as part of the pilot study over 5,000 patients, and the average diagnostic rate was around 36%, but in a number of our flagship areas, we're achieving a 50 to 70% diagnostic rate. And this is led by demonstrating the cost effectiveness and how useful this is as part of the diagnostic workup. This has really led us to be able to provide the evidence to government for the inclusion of subsidised genetic testing for childhood syndromes and intellectual disability to be listed on Medicare. So it's now available for all families around the country. It was really quite a compelling argument because we demonstrated that by using genomics, we were able to get 5 times the diagnostic rate at a quarter of the cost for kids with rare disease. We've also developed a national clinical consent form that is used around the country, and we've established clinical recruitment sites in every state and territory to make all of the research easier in terms of having joint ethics and governance around the country. We've established a great community advisory group that really looks at and informs everything that we do. Most importantly, during COVID, we've often had to do things remotely. So a lot of what we do now has converted to the use of telehealth and electronic consent forms. And this is really enabling our reach into remote areas. One of our very successful programs, as an example, has been acute care genomics, because way back in 2016, it was taking a couple of months to get a genomic diagnosis. But if we want to treat the most critically ill kids that are in intensive care units, we had to really shorten the time to diagnosis. And we started this as a pilot program and have since expanded to all of the neonatal and paediatric intensive care units around the country, shown here, with over 400 infants and children now being part of this program. We've been able to take that diagnostic testing from a couple of months down to a 3-day turnaround, which means that it is very effective for kids in intensive care. We've had a 50% diagnostic hit rate, and previously most of these children were not able to be diagnosed while they were still in intensive care. And that's led to a change in treatment in over 75% of the children involved. So a real success story. Just, I think some of the stories here, first of all, from one of our clinicians, the diagnosis was so unexpected, but so clinically relevant. I wouldn't have thought of this disease, and so she would have lost her first kidney transplant. Thank you so much for running this flagship. And to the families, this diagnosis meant they could stop speculating about the cause, which in Joshua's case turned out to be genetic, and focus instead on managing his condition. The other study that we're running now is called Mackenzie's Mission, named after a beautiful little girl who died of spinal muscular atrophy in 2017. And the beginning of Mackenzie's Mission, this was to really look at making reproductive genetic carrier screening available around the country. This study, we're aiming to study, and we will by the time it's completed later this year, around 8,000 couples across the country. And instead of just screening for a handful of disorders, we've expanded this so that we're now screening 1,300 genes for over 750 conditions that have a severe and childhood onset and are major causes of death and disability. So this again is a very successful program of work, and we're now working with government to look at how this could be funded into the future and available for all families. Underpinning this from a research capacity is an establishment of the Australian Functional Genomics Network, which is bringing in all of our laboratories around the country that study disease mechanism to really look at increasing the diagnostic rate, and most importantly, moving that identification and mechanism into developing better therapies for our kids. We're now in the second phase of Australian Genomics, funded by government through the NHMRC. And we're really moving now, we're not running the flagships, but we're supporting government-funded research around the country to maintain this nationally coordinated approach. And most importantly, you'll see over here, the intersections of Australian genomics into research, but then how we're bringing this into the healthcare system across a whole different range of disease groups and areas. We're also working in partnership with government at the state and territory level so that we're looking at ongoing funding for this work and making sure that all of the work we're doing and all of the research is translated as rapidly as possible into clinical practice, and making sure that we're also training up a genomics literate workforce to apply this widely. The capabilities that we offer to underpin this is a national coordination network that I've talked about from the research perspective, the resources for consent, for education. Really now we're developing standardized approaches to how we handle clinical and genomic data safely and securely around the country, and providing that advice and standardization as we're also working with government. We also provide expertise across a number of really crucial areas in health economics, in implementation science, in evaluation and education. and are also supporting very strongly that translation of project outcomes into policy and practice. We have a wonderful community advisory group that is continuing and really increasing its reach around the country. And we're now developing Involve Australia, which is based on a very successful model that's based in the UK. And this is really looking at increasing our involvement of consumers and patient advocacy groups in the design of what we do and how we take research programs forward, and also increasing those links with national and international experts and building up policy and guidance to support the involvement of the public in genomics research. So watch this space. And now into the global community. And in Australia, we're a very strong part of what is called the Global Alliance for Genomics and Health. I myself am the vice chair of this amazing organisation, which is across over 600 institutions and across over 100 countries. So we certainly are working locally, but acting globally as well in terms of sharing knowledge and developing the standards. And as you can see here on the right, rare disease is a really incredibly big part of this. What we do within the Global Alliance is use real-world examples such as Australian genomics to drive and develop standards across all of these technical work streams, as well as very important parts around data security and regulatory and ethics. So it's a continuous partnership between those that are working in the area and how we develop all the tools we need to make this more effective. So as I've mentioned, we've got, it's now over 100 countries involved, but what we're really driving to is enabling and establishing a global learning health system so that we can share all the knowledge around rare disease and all of the learnings to make for more rapid diagnosis and more rapid treatment. And really, we need these standards across all of this continuum, going from consenting the patients to the sequencing, making sure we're all speaking the same language when it comes to talking about genomic data, around the ethics, how we safely and responsibly care for the data and maintain privacy, but also that we can find relevant data that can be shared and used for research. One great example is matchmaker exchange. And so that means when a patient comes in and sees a geneticist, they've immediately got access to all of these resources around the world to look for similar cases, which can be great in learning about the natural history of the disease, the experience of other patients, but also in gene discovery and really making diagnoses more quickly. I also chair with Mark Caulfield, who's the Chief Scientific Officer for Genomics England, the Genomics in Health Implementation Forum. And we're foundation members with Genomics England. And again, this is at the clinical level and at the implementation of genomics level, bringing all of that collective learning together and identifying further areas where we can collaborate. And it was great news at the end of last year, which I thought you'd be interested in. The UN adopted the first ever UN resolution on addressing the challenges of persons living with a rare disease and their families. So many key areas have been touched upon, including inclusion and participation in society, making sure there's universal and equitable access to health services, really uniting these national strategies and actions, and really bringing rare disease up as a priority internationally. And our Australian genomics representatives are also involved with WHO and the Collaborative Global Network for Rare Disease. So it takes a village, and as I've said, there are hundreds of people involved in Australian genomics around the country, and it's really been a major effort, but a thrill to work with all of these people to really accelerate what we can do for the diagnosis and treatment of people with rare disease around the country. Please feel free to contact us, to look at our website, to look at our resources. We're here to help. Thank you very much.
Welcome back. And I hope everyone's not feeling like they've just been in a washing machine or on some massive kind of speed dating program, and your heads are spinning trying to remember what was it you talked about and with who. What I'm not sure about what experience everyone else was having, but what a great exchange, certainly in the room that I was in, of different ideas. Some, how do we do things better, but some brand new, like some, here's an innovative way of looking at something that we've been talking about for a really long time. So I hope all of you found that you were having that kind of an experience as well. We have, as you're aware, recorded all of those sessions for use of the GSNV only. So we will transcribe and extract the big ideas from all of those rooms, remembering that today was a beginning of the discussions and opening the door to important issues to say, this, we have to take this forward, and how do we do that? And I think we got some discussion about both, certainly where I was. Overarching theme in all of the groups that moved through the room that I was in was that, and it's been all day, that it's going to take all of us. It's going to take patient support groups, people with lived experience, working with research, working with health professionals, working with industry, educating ourselves and all of those groups as well in how we go about moving forward to achieve those goals of the UN Declaration, which is physical and mental health, and the right to physical and mental health, but the right also of that to be able to take care of your family and your own well-being in that space as well. So I hope you're carrying with you some real inspiration out of today, some real hope that in all of the experts and all of the people that I just mentioned, there is a real want, there is a real appetite to want to solve some problems that have been around for a long time. And I'm delighted that the GSNV is working really hard on those problems. I apologise to everyone who got cut off in those conversations, everyone who had an idea and didn't get to actually say it. Please reach out if there is something that is burning in your mind that you would really like to express. But know that we will be taking this further. I want to say a big thank you to my team, to Holly in particular, who has put in an enormous effort to bring today about, but also to all of my team, and to thank each of you for coming along, to our professional experts that we brought together based on a targeted area that we believe is really important to taking us forward. We're just continually blown away by your generosity and your support, and so grateful that you come to the table with us as people that are interested in having the conversation and working out how we move forward together. And I've said it 100 times, but we can't do it without you, but you can't do it without us either. So together we will get there. For all of our community, I mentioned some things to get involved with. Please reach out if you'd like to join any of our working groups. Watch out for the Rare Insights survey that I mentioned will be coming out in the next quarter, because it's going to put a line in the sand about where the Australian rare disease community is. And we saw some of the importance of that in Lauren's presentation from Genetic Alliance UK. So again, we went from such a large kind of perspective of what's happening around the world to what does it mean for us and how do we make it happen? And that reinforcement is going to take top down and it's going to take bottom up. And we have to be there at all levels to change the world to one that we all want to live in. So thank you so much to everybody. I'm going to close our Rare Disease Day event there and wish you all the very best for the balance of Rare Disease Day. And we'll see you again the next time we all have an opportunity to get together. Thank you.